cause could be an associated erectile dysfunction. I am Dr. Pranay Gandhi, MBBS, MD, PhD in sexual medicine and psychosexual counseling. So what are the treatment options for premature ejaculation? Well, based upon your test results and examination, a doctor would like to advise you counseling, psychotherapy, behavioral therapy and medications, which include prescription medicines as well as supplements. Well, the cause could be an associated erectile dysfunction with low testosterone. So if we improve the testosterone levels, your premature ejaculation will improve as well. The cause could be the hormonal imbalances. If we could correct that, then your premature ejaculation will improve. And third, most commonly, hypersensitivity of the penis, especially the glans penis. If this hypersensitivity is improved, then also the hyperexcitability causing premature ejaculation will reduce and definitely your symptoms will alleviate.